Okay, so composite filling material is a white filling material, comes in a range of shades which are designed to match your natural tooth structure. So composite is the name of the filling material. Composite bonding or cosmetic bonding is the actual procedure where we use the filling material to do a variety of treatments on patients. So composite bonding can be used for improving the colour of the teeth, the shape of the teeth. It can be used to close spaces between teeth, either before or after braces. It can be used to protect the edges of the teeth, so if they become worn down, you can put composite on the tips of the teeth to strengthen them. And so there's amazing results you can get as a result of using it. Okay, so depending on what treatment you have, so composite filling material can also be used for filling cavities. So if you've got decay in your tooth, you can have the filling placed in one session. If you are having veneers done, or you're having cosmetic bonding done to add edges to the teeth or close the gaps, and sometimes we would get something called a diagnostic wax up done. So we take impressions of your teeth. They would be sent to the lab, and I would ask the lab to do a mock-up of what your teeth could look like on a model. You're then able to look at that model and see what sort of result you're going to get. We can also use that to actually replicate it in the mouth, so you can see what it's actually going to look like in your mouth before. So if we go that way, it would normally take 2 sessions, one for you to see the wax up, and the next session it can all be done in one go. So composite bonding, they're essentially a similar treatment. Composite bonding is where you add the white filling material to the tooth. So that can either be just certain areas of the tooth, whether it be to close gaps or add to the edges. But a composite veneer just means that we are covering an entire tooth surface with the composite filling. Most of the time, cosmetic bonding is just an additive treatment, so it doesn't involve any drilling or any preparation to the tooth. So most of the time it can be done with no anaesthetic and no preparation to the tooth. It's a very gentle treatment. Okay. Absolutely. So it depends on the degree of crowding they might have or the issues they might have. So some people might have really large spaces between their teeth, or the teeth might be really crowded and really out of line, and therefore we'd normally advise braces as a gold standard before treatment. But even after a course of braces, people can still have a little bit of spacing, a little bit of unevenness afterwards, and composite bonding can just perfect that final result. Whereas some people will have just mild spaces or mild crowding between their teeth, and cosmetic bonding can be used as a substitute for orthodontic treatment, yes.
Eventually. Okay.
With composite filling materials, they are just a filling material, so they are at risk of staining and at risk of chipping. We'd normally expect the treatment to last about 4 to 7 years, but I've done treatments that last far longer than that. As long as you look after them, you're avoiding certain staining foods and drinks and smoking, and you're not biting anything too hard with them, then generally they are very long-lasting treatments.
Okay.
So I've got years of experience of doing that. I use a special light that replicates natural daylight, so that will help me match the filling material. I also do a mock-up before I start treatment, so I'll place a small little bead of a variety of shades on the tooth before, and then I'll know, and I'll set those, and then I'll know exactly what sort of shade I'm going to be using. Sometimes I may just use one shade, and sometimes if I need to replicate a natural tooth, for example, if I'm just doing one filling and it's next to a natural tooth, I might need to do 2 or 3 shades. So it does vary from case to case. Unfortunately, if you want to whiten your teeth, we always advise to do it before cosmetic bonding. So once you whiten your teeth, we would then match your composite filling to your new shade. If you decide to whiten after, then unfortunately the fillings would not change colour. Only your natural tooth will change colour with whitening. So we always advise to whiten before and then have the cosmetic bonding after.